So guys, welcome back. So another session of the image based questions, and this we images I have picked which are the most repeat ones and which are asked in the NEET PG also. Okay, so combination of both is there. So let's quickly discuss. It will be a 5-10 minutes video, and in this we'll quickly discuss. You can watch it anytime during your breaks. Okay, so the first image, the question asked for this image was that, as you can see here, the defect is there here, no, between the arc and the aorta and this pulmonary artery. So this is called as a PDA, patent ductus arteriosus, and this occurs defect occurs if there is persistence of the sixth pharyngeal arch. Okay, so this was the question asked, that this defect arises due to which reason. Okay, so sixth pharyngeal what artery, sorry, I think, yeah, sixth pharyngeal arch नहीं है, artery है, sixth right side का artery है, ठीक है. ओके, फ्रेंजल आर्चेस का क्वेश्चन है, बहुत इंपॉर्टेंट है ये वाला. देन द नेक्स्ट क्वेश्चन फ्रॉम द फॉरेंसिक मेडिसिन. सो दिस इज द इमेज done for the test for the semen analysis. Okay, semen analysis, and you can see here brown, dark brown rhomboid crystals. So the name of this test is, so this is the Florence test. Okay, a similar test done for the semen analysis, Barberio's test, and in Barberio what we can see yellow shaped needles. That is the Barberio test. Okay, so expecting one question from this one in the upcoming FMG, either it will can come on the fluorescence or this Barberio, because Barberio's test and fluorescence test are repeat topic, a must know. Okay, then let's discuss three important images from the ophthalmology. So this is also quite famous image, asked repeatedly multiple times, and this one also. Okay, so these two are the cataract. This one is the oil drop cataract seen in the galactosemia, can be asked in integration with the biochemistry also, because galactosemia defect in the carbohydrate metabolism. ठीक है, तो इसके integration में वो पूछ सकते हैं. बाकी this one, this is rosette cataract, and this is seen with the blunt trauma. So they can give the image, they'll give the image and they'll ask what is the cause of this one or which kind of cataract it is. Okay, then this image, this is the pink vacula, and this is a yellow brown fatty kind of tissue accumulated in the sclera in the eye. Okay, so this is all about the what images from the ophthalmology. Now these two images, the image, this image is of the bladder, and this is the bladder cancer, bladder carcinoma, asked in the NEET PG. Okay, so this is the image from the NEET PG. Let me write it down, bladder CA, and this image, a radiograph image of the intestine, and this one you can see here, this is called as a upper core deformity seen with the colon CA. colon cancer में ये kind of appearance दिखता है and called as the apple core deformity. ठीक है. Then moving on to the next two images. This image also of the NEET PG, and this image is of the seminoma. Okay, seminoma. Okay, so they had given the gross appearance, and along with that they had described even a case. I think I exactly don't remember the words of the case, but there was an elderly man and he had testicular enlargement, and on like you did the surgery, and on surgery you saw this gross examination. So it is the seminoma. Then the next image, Marjolin ulcer. Okay, so famous question, MARJOL line, as well as famous what image. Okay, from the surgery asked multiple times. Okay, so the questions again you must remember from this Marjolin ulcer is that it is occurs due to the chronic non-healing ulcers. ठीक है, तो जो भी chronic non-healing ulcers रहेंगे, अगर वो बहुत दिनों तक है तो they can convert into this Marjolin ulcers. ठीक है. Then the next image of the mouth, and this is used for the assess the difficulty in the intubation. Let me write it down, difficulty during the intubation. जब हम ET डालते हैं ना, तो we'll look कि divided into the 4 classes, and we will look that how much it is difficult for us to put it the ET tube. Okay, endotracheal tube. Okay, so 4 classes are divided, and this is about the thing. So they can just ask that this classification, this classification is called as the MALLAM Malampatti classification. So the questions are asked on the Malampatti, either what is its use or on the classes. Okay, they will give this image and they'll ask what class it is. So it is the class 1. Okay, like that. Then this is the image of the ranula, and in this image you can see that there is a mucus extravasation cyst under the floor of the tongue. So the most common location is the floor of the tongue, and the questions are asked on the management, how will you manage it. So it is the excision. If it is recurrent, then we will be doing the excision. Okay. Then this is the thyroglossal cyst, and seen most commonly in the young age group, like some 15 year की एज की प्रेजेंटेशन दी गई होगी हिस्ट्री में, एंड दिस इट विल मूव ऑन डिग्लूटिनेशन एंड swallowing. ओके, तो swallowing के टाइम पे इट विल मूव अप, एंड yes, this is about the thyroglossal cyst. Then the next image one image from the ENT, the X-ray. So it is the Peary's view, because as you can see here that the mouth is open. Okay, similarly Waters view में क्या होता है कि mouth will be closed, but in this the mouth is open. Okay, Peary's view for the looking of the paranasal sinuses. Okay, paranasal sinuses. Then this image from the orthopedic. So you can see here that there is a patellar fracture. So the question asked was on the management. How will you manage this case? So we will be using the K wires for this. Okay, K wire ring. Then the next image from the micro, quite famous image this also. See, you can see here brown color sclerotic bodies. So these are called as the sclerotic bodies, and these are seen in the chromoblastomycosis. So chromoblastomycosis is a quite famous disease asked in the exam. Chromo in the sense brown color, and mycosis in the sense it is the fungal disease. ठीक है, तो brown fungus is involved causing the disease, and most common location is the foot and seen in the forest workers. ठीक है, so some important points, keywords which you must remember, and if case is asked then see these things: forest worker, fungal infection, foot is involved, then go with the answer as the chromoblastomycosis. Then the next image of the ear, and this is a tympanic membrane, and you can see here some reddish mass present. Okay, so this one is called as the glomus tumor. ठीक है, तो they can give this also no simple image और clinical case भी दे सकते हैं इसमें. So you can see a reddish appearance. Then this what instrument, the question was asked, what is this instrument called as? So it is called as the Humphrey's knife, and the use of this one is for the skin grafting. ठीक है, so सर्जरी में भी पूछा गया है, डर्मेट में भी पूछा गया. ठीक है, तो आस्ट मल्टीपल टाइम्स ऑल्सो दिस वन. ठीक है, Humphrey's knife, skin grafting. Then the next image from the forensic medicine, again an important image. So what kind of defense wounds these are called as? So these are what kind of wounds these are called as? So these are the active defense wound. Okay, in the sense when the person is trying to protect himself from the attack, that time he will be getting these wounds on the hand. Okay, so these were some important images which you must know, and the repeat images. Okay, so if this video was useful, comment below, and if you want more of such videos, so comment below. Okay, then subscribe to GrowMed if you're new to GrowMed, follow, and you can also follow me on the Telegram channel as well as the Instagram for more amazing things related to the FMG. Thank you so much guys. Bye bye, and all the best for the exam.